We will be talking about the specific program that we created here at the University of Chicago.
I'm the manager of a remote program at Grady in Atlanta. We are new to HRS. We're just launching, but we've been with another vendor, and we've been billing for the last 3 years. Medicaid doesn't pay, Medicare does, and we're doing it for our high-risk hospital discharge patients. The reimbursement is decent, but I think what you need to be aware of is it's probably still a good idea for you to drop those codes, the 9945457s, the 99091s, because you generate RVUs so that you can show your organization the workload so that you can get the help that you need.
And so from an enrollment standpoint, the 99453 would be that initial setup in patient education that can be billed. Some states, even we're talking about Florida now does cover reimbursement for RPM service.
One thing I didn't hear anyone talk about, which we are doing, is we're actually enrolling patients and billing RPM throughout the pregnancy. So we have 4 cascades, but really are only using 3 of them, but gestational hypertension, preeclampsia, and then postpartum hypertension. And we are billing Medicaid and actually getting reimbursed.
How do you escalate your blood pressures? Like, who manages them 24/7? And are their blood pressures just managed during the routine prenatal visits, or you have extra visits and extra telephone calls just based on your antepartum blood pressures? Because that's a lot of manpower.
So I actually have a dedicated L&D nurse on my team who watches over just the pregnancy pathway.
Did anybody look at readmission rate before and after they started the program?
So yeah, I think we have readmission rate before, and just being 3 months in, I think we're pretty new and we're going to start thinking about collecting data. However, in the first month, we didn't have any readmissions. So that was a win.
One of my biggest concerns when we started this, and now obviously it's been going for 2 years, like seriously, one of my concerns was we're going to miss things. That was my big concern. Somebody's going to get missed, and it's like but I found the opposite. Actually, our readmissions rate went up.
We've had at least a couple readmissions, but they were spot on, right? They needed that care. And that's exactly what it was. So, and we were almost excited to have a readmission, right? Because we prevented something worse from happening.